Thank you for the time. I'm going to present my research. The title of my research is The Relationship Between Oral Health and Brain Health. The background of this research are oral health is often considered separate from the health of other organs in the body, whereas in fact oral health is an integral part of overall health. Recent studies have shown a correlation between dental health and brain function. This is important to understand so that we are more motivated to maintain optimal oral health. And the purpose of this research is to examine the relationship between oral health and brain health. Next, the method of this research. This study is a literature review, which involves analyzing various sources related to oral health and linking them to brain health. The literature used in this research includes reference books and research journals. Okay, now I'm going to explain the result of my research. The result of this literature review show that a healthy oral cavity is indicated by healthy teeth free from caries, infection and bleeding gums, with no excessive plaque and no chronic smooth ulcer. The indicator of oral health include the Oral Hygiene Index, DMFT, PTI, and periodontal health status. The human brain is the control center for all body organs and the mind. Brain health is also influenced by the condition of other organs, including the teeth and mouth, for example, the presence of oral infection. The mechanism of this relationship can be seen, for example, in chronic infection of the periodontal tissues, which can lead to systematic inflammation. Oral bacteria such as Porphyromonas gingivalis have been found in the brains of individuals with Alzheimer's disease. This chronic inflammation weakens the brain's blood vessels and accelerates the degeneration of nerve cells. Scientific evidence obtained from previous reference includes, for example, a 2020 study which found that patients who had loose teeth had a 1.5 times higher risk of experiencing cognitive impairment. Another study also showed that regular periodontal treatment can reduce inflammatory biomarkers in the brain. To prevent such condition, effort can be made to maintain oral health by brushing teeth regularly, that is at least twice a day, using proper techniques, consuming healthy food, using antiseptic mouthwash, and having regularly dental checkup. And the conclusion of this research. Based on the result of the literature review, it can be concluded that oral health should not be separated from brain health, as inflammation or infection in the mouth, including the teeth, can contribute to the decline of brain function. One of the efforts to support brain health from the perspective of oral health is by maintaining good dental hygiene. Healthy teeth help improve brain health and support cognitive function. And for the last, I would like to say thank you for your attention. Goodbye.